Dear ladies and gentlemen, I see we are a small group. I think that's nice because then maybe we can do some good questions and answers. I think there are 5 competitive sessions. So we will speak about an issue first, which is actually also a new concept in thinking how we go along with vaginal infections and what is important for this. And this is my disclosure of conflict of interest. So basically, when we go back and think about why is it important that we look at this issue of vaginal infections, we see that, of course, vaginal infections are very frequent. So in practice, there's a lot of women coming to the practice and complain about this infection because they have disturbing symptoms. But also we have a problem as gynecologists because the recurrence rate is high. So if you treat the women, many of those, at least half of them, will come back after a certain time and complain that the infection came again. So this issue of recurrence is actually something which is pretty annoying for the patients, but it's also for you because the patient thinks you're not a good doctor if it's coming back with the infection. So you have unhappy patient, but you can also have secondary consequences of the infections, which is in primary instance the ascending infections, PID, the infertility as a consequence of pelvic infections, but also in pregnant women, the pregnancy complications. I will go into pregnancy complications in my second talk today. So what is the main vaginal infections? It's very easy. You need to think about if she has bacterial vaginosis, if she has candida infection, or if she has aerobic vaginitis. The fourth one, which is a trichomoniasis, a protozoa infections, is rather rare. It's only about 5 to 10% of all infections. So it's basically 3 you need to think about. And if you go for a diagnosis, it's also very easy. You can do that in your private practice. You can just need a microscope for that. You have the magnification 40 times, phase contrast, and then you can see, for example, very easily here in this preparation, the candida infection. You can see here also the trichomoniasis with a moving protozoa about this picture. And you can also make the diagnosis of bacterial vaginosis. You know that this is a gram stain, but you can see here there's a lot of abnormal bacteria and you have the clue cells. If you go for the diagnosis of bacterial vaginosis, you have 2 options. Either you say you make a bedside diagnosis and then you have your 4 criteria. You have the gray discharge, you have the positive odor after KOA supplementation, which is the positive amine test. You have the clue cells in the preparation and you have the pH, which is elevated. You can also send the preparations to the lab, but the lab should not do a bacterial culture, but they should do a gram stain and then classify the bacteria according to their abnormality or to the lactobacilli. So basically, in bacterial vaginosis, as you know, you have a shift from a normal flora to an abnormal flora. That means that the normal lactobacilli, they decrease, and abnormal germs such as Gardnerella, Atopobium, and Mycoplasma are increasing. So basically, we need to think about this concept. So what is a normal ecosystem and how does it work, and what is the role in infections? So as you know, if you think back to your medical studies, you have learned that the beginning of the whole story is the estrogen. The estrogen leads to a proliferation of the epithelium in the vagina, leading to proliferation and desquamation. What happens with the epithelium is also it's producing glycogen, which is disaggregated to lactose and to lactate by the lactobacilli, leading to the lactate increase, acidification, but also a superoxide production and adhesion. So this is a normal system, which is a defense system. So it's a host defense system against abnormal bacteria. So what happens in the disturbed vaginal system. You can see here the proliferation of epithelium is abnormal, so it's decreasing. The epithelium is damaged. You have not the normal germs here, the lactobacilli, you have the abnormal germs, and as a consequence, the immune response in the vagina is all spotted. So if you want to have the story make it easy and try to make an easy diagnosis in your practice to see if a woman has a normal healthy flora or if she has an abnormal unhealthy flora with a decreased defense, is very easy. So you don't need to have a big lab, you don't need to have an expensive diagnosis. The only thing again is you need to have a microscope. If you have the microscope, you can look at three things. And this is a very quick diagnosis. If you have experience, you make that diagnosis in 2 minutes. So first is you look at the cells. You have of course, the epithelial cells. You look if this is parabasal or basal cells, or if it's superficial cells with a large cytoplasm and small nucleus. Then you look at other cells such as leukocytes, which are increased in inflammation, and sometimes you also have some erythrocytes. The second is you look at bacteria. So you look at if there is normal appearance of the bacteria or you have abnormal. And the third is also very quick and easy. It's the pH measurement, which you could do on the smear with a easy paper stripe. So if you look at the microscope, you should try to classify the number of, or the normal appearance and the abnormal appearance. And you have three classes. Basically, class 1 is normal, class 3 is abnormal, and you have the intermediate classes. And I'll show you that. That's the normal flora. You can see here one epithelium, superficial epithelium. You have the rods, which are representing a lot of lactobacilli. This again is a normal flora. You go to the intermediate flora, so you can see that you have less lactobacilli, you have some, but you also have other bacteria, and it's not such a clear picture as you have. Again, here some lactobacilli, that's a big one. Here you can see smaller ones, but you have also cell detritus, you have some leukocytes, and you have smaller bacteria. And then you have class 3, abnormal, which is the grossly abnormal flora, and you can see here you have not the good superficial cells, you have more parabasal cells, and you have a lot of leukocytes. There's no lactobacilli at all, and you can see here some abnormal bacteria as well, and this is the same picture, almost no lactobacilli at all. You can see here that's a typical aspect, grossly abnormal flora in bacterial vaginosis with occlusive cells. So this diagnosis is made very quickly. If you have some training, some experience in microscopy, you don't need a lab, you don't need a gram stain, you just need to put this smear preparation under your microscope. So if we speak about abnormal vaginal ecosystem, we don't need to speak only about bacterial vaginosis, we also need to speak about aerobic vaginitis. You see on the left side, typical aspect of bacterial vaginosis, it's no inflammation, very little inflammation, but you have pathogens, you have anaerobes. On the right side you see the aerobic vaginitis, and as the name signs is a vaginitis, not a vaginosis. That means vaginitis is inflammation. That means you have some leukocytes. You have typically a very decreased atrophy of the epithelium, and you have a very high pH, which you can measure. So in these infections, you have the challenges, of course, that you have high recurrences in all different kinds, even if it's a bacterial vaginosis or the candidiasis or the aerobic vaginitis. You always have a lot of recurrence, which is about 50% in the next 3 months of recurrence. So that means that you need to find a way now how to avoid the recurrence. This is a study showing it's even 60% in 12 months after metronidazole therapy of bacterial vaginosis. So the women come again, and then you need to think about what should you do next. And the clue to this is, of course, that if you treat the bacterial vaginosis or another infection with antibiotic or a local desinfectant, you need to restore the normal flora, because if the normal flora is not restored, the infection will come back because the physiologic defense mechanism is disturbed. So that's basically also the reason why you should think about restoration after the treatment, because of the recurrent infections. You can also, with a normal flora, avoid new infection by sexual transmission. If the partner, for example, has bacterial vaginosis or abnormal bacteria with anaerobes, you can prevent recurrence and resistance, and you even can use a restoration after antibiotic treatments for any other indication which is not a gynecologic. Maybe you have another reason to treat the patient with antibiotics. In these cases, many women develop vaginal candidiasis, and there you can do the local treatment and the restoration, and you can even use it as a prophylaxis. Now is the question, is this maybe one way to have a longer treatment with metronidazole in bacterial vaginosis? This is a study looked at the longer treatment. You can see it's a 4-month suppressive therapy for women who have recurrent infection, but you can also see what happens. In 50% you have cure of metronidazole, but you have very often candidiasis. And in 25% you have cure for placebo. So it's not really the best cure rate, to be honest, if it's only 50% and then you have the candidiasis. So this is not a solution. And the reason why it's so difficult to find a cure rate is that if you use an antibiotic like the metronidazole, if you use any other agent, it's very difficult to go to the biofilm. The biofilm is a complex where the bacteria, where cellular detritus is in it, and a lot of bacteria are hidden here. And so if you have the superficial treatment and you don't do anything about the normal flora, this biofilm will lead to a recurrence of the infection after a certain time. So you also have to find a way to break through this biofilm and bring the treatment to the place where it's needed. So what happens if you use antimicrobial treatment? You can find that you here with different agents such as metronidazole, clindamycin or dequalinium chloride, you kill the pathogens, but you don't have a normal flora afterwards. That means that you need to restore the disturbed vaginal ecosystem, that you have this normal cycle with lactobacilli producing a low pH, and then you have again a normal defense mechanism. So that means that restoration of normal vaginal ecosystem is mandatory to prevent recurrence, chronification, development of resistance, and occurrence of other infections. This is a rationale why you should use probiotics. And this is a theory. You can say that's all not true. I want to see studies. I will show you some studies. It's not only with the oral use, it's also with the vaginal use. But I will show you all the studies present about this. So what are probiotics? Probiotics is live organisms which, when administered in adequate amounts, confer a health benefit to the human by restoration of a normal flora ecosystem. So the significance of the normal ecosystem has been recognized. Antibiotics is not the solution because it does not lead to an improved host defense. So what is the necessity of characteristics of probiotics in the vagina? You have some typical characteristics which you need in the probiotics, which is a high adhesion to vaginal epithelium. That means efficient competition with other bacteria because they sit at the epithelium in this biofilm. They need to produce a high number of lactate. So there is different strains of probiotics, which is lactobacilli. Some of them produce a lot of lactate, some of them only produce very little. So you need those ones who produce a lot. Then they need to produce a lot of hydrogen peroxide, and they need in the end produce also biosurfactant in order to destroy the biofilm and to access the right place of action. So I speak here now for these vaginal tablets, Gynoflora. This is one example. You can find on the market other products of probiotics, but I think this is a good example because it not only treats, provides lactobacilli, but it also provides the food for these bacteria. And the food is clear, is the estrogen. You can see here it has a very low dose of estriol, 20 times lower than the normal dose in, for example, hormone replacement therapy. And this leads in vitro to a high lactate and hydrogen peroxide production and inhibits growth. These bacteria, scientific rationale for estriol is clear. And then you need to explain, of course, the patient why she should, after an infection treatment, restore her flora. You need to explain her that it's a natural treatment, that it's no antibiotics with side effects, and she needs to restore her natural defense mechanism. And if you don't explain her, she will not take the tablets, because after treatments the symptoms are gone, and you need to tell her why she should have this restoration treatment. But if you explain her, people understand, because they are not stupid. They know every organism has its natural defense mechanism, and if you explain, they understand, and they will also take this treatment. And you can see here how lactic acid production is very effective, how hydrogen peroxide production is effective, and you can see here also that these lactobacilli might overgrow and fight against the abnormal mechanisms. So the indications for the probiotics in general is first the restoration of the normal host defense microflora after antibiotic treatment, after vaginitis, which you treated with antibiotics or anti-infectives, prevention of recurrence, of course, prevention of pregnancy complications if there is a pregnancy ongoing, and also to treat the atrophy in atrophic vaginitis. And this is one study, this was in 125 women. They were all treated with metronidazole, and then after metronidazole they obtained, in this case, oral lactobacilli for 30 days, and they were looking which group, placebo group or the lactobacilli group, had more recurrences. And you can see here healing rate was 100% with lactobacilli, without it was only 70% according to the Nugent criteria. These were all women with bacterial vaginosis, in this case premenopausal women. That's the kind of the first study. Another very important study looked at the vaginal administration of, in this case, Gynoflora, the lactobacilli combination with estriol, and they made a study looking, first they had in bacterial vaginosis anti-infective treatment for 1 week, then they had 2 or 3 days where they waited, and then they made the treatment with Gynoflora as compared to placebo. That was a single-blinded randomized controlled trial, and they looked then what happens at time point 2 and 3 with these women. And they looked at the normal flora index, looked if the ecosystem could be restored. And in this case, you can see here a significant restoration in the patients treated with the probiotic, the Gynoflora, as compared to those ones with lactobacilli. And this was 360 patients who were randomized. You can see, of course, also the number of lactobacilli was improved as compared to the placebo group, and in this case what's the most important was it could be a decrease of the recurrence rate of the bacterial vaginosis. You can see here that it's only 8% in the Gynoflora group with recurrence as compared to 13% in the placebo group. So this is quite a nice randomized controlled study proving the principle and the rationale about restoration, what I told you before. But it's not the only study. Here is a collection of studies where they used all different kind of preparations, vaginal route, oral route, both vaginal and oral route, and they all show the same effect. It's all positive effect. So the systematic analysis of these 25 studies, they show that there's clear benefit for treatment of restoration for the prevention of bacterial vaginosis, and in the end the conclusions are that in the adjuvant setting probiotics have a prominent role in the restoration, enhancing the effect of antibiotic treatment, preventing recurrence and preventing candida and other types of infections. In some cases, in the recurrent cases, sometimes also repetitive courses of probiotics or even a prolonged treatment over several weeks or months is advisable. And due to these properties, probably Gynaeflora as a combination with estriol has a good place in this treatment. So take-home message is first, vaginal infections occur frequently, have a high recurrence rate. Second is that a healthy vaginal ecosystem depends on the abundance of lactobacilli. Infections as well as anti-infective treatment disturb the ecosystem, like not only the infections but also the antibiotic disturb this ecosystem. And then, of course, probiotics, they have been proven that they are effective in restoration, the normal ecosystem, and that they, with that, prevent recurrence of these infections. With that, I'm finished, Mr. Chairman, and I thank you very much for your attention. I'm open to questions.